RSV, a respiratory virus, is making young children, especially babies, very sick, and cases are on the rise tonight. That's on top of an already active flu season. As you can see from this map from the CDC, North Carolina is in yellow. That means substantial spread. But look at the states around us. They're already seeing more cases. And we can't let our guard down about COVID-19. As we head into the winter months, it's not a tridemic just yet, but if something doesn't change, we could be headed in that direction. Good evening and thank you for joining us. I'm Gerald Owens.
And I'm Lena Tillett. This is especially worrisome for parents concerned their children will get sick at daycare or at school. WRAL's Aaron Thomas talked to the experts about what we can do to slow the spread of all three illnesses. And he joins us now live with what they have to say. Aaron?
Yeah, Lena, doctors tell me that they are seeing cases of RSV and flu skyrocket in area hospitals like Wake Med here behind me. They're certainly hoping that this uptick in cases does not strain the healthcare system. When you're a parent like Michelle Lyon Atkins, protecting your child against seasonal viruses are a serious matter.
So it's definitely a worry.
Her latest worry, an unseasonably early spike in respiratory syncytial virus or RSV cases among young children. Factor in an active flu season and a possible rise in COVID cases.
It just feels like you can't escape getting something.
We're seeing a substantial number of more children than we would expect at this time of the year hospitalized due to RSV. And we've seen a few cases of influenza hospitalized.
Dr. David Weber from UNC Hospital says people with RSV may show cold-like symptoms, fever, cough, fatigue, headache, but it can be life-threatening for some children.
Young children, you have to be careful for seizures due to high fever, turning blue from not enough oxygen, lethargy, and not eating well.
Take a look at the latest numbers from area hospitals. Wake Med reports 246 patients battling influenza, up from 130 cases 2 weeks ago. As for RSV, there are 183 cases. For context, pre-COVID data from previous years shows there were about 80 cases a week. Doctors at UNC Health report approximately 30 cases of influenza and approximately 200 RSV cases in their hospital.
I do think we're going to see these numbers continue to rise over the coming weeks and months.
A stark warning from Jessica Dixon with Wake Med Hospital, who urges families to do their part to prevent spread of viruses.
Everything you can do to keep sick kids at home is really important, to keep your child away from other kids that are sick.
Yeah, that along with avoiding close contact with anyone with these symptoms is really your best bet right now because there are currently no vaccines approved for protection against RSV. Lena?
Aaron Thomas live in Raleigh for us. Thank you.